Good afternoon. Bonjour.
Bon après-midi. Mardi, les Gilets jaunes de la santé ont amélioré, vouloir améliorer les services. Il y a eu diverses réactions et je voudrais vous dire que
In our province about families unable to see doctors, seniors waiting in hospitals, and our inability to attract professionals in our rural areas. I know you are concerned about these changes. I can appreciate that you are concerned about having access to emergency services and your ability to see a doctor. C'est exactement pourquoi nous
this is why we are determined to improve the system, and this is why we asked experts to present a complete plan.
to improve the system. And it's why we asked the experts to bring us a comprehensive plan to deal with the challenges of our aging population, rising mental health crisis, and the labor shortage. We don't have the option of ignoring this any longer. It is critical that everyone understand that the changes that your government accepted are designed to keep our hospitals open. They're designed to protect hospital services across the province. Il est essentiel que tout
It's essential that everyone understands that the changes proposed by your government will be to keep all hospitals open and to protect services in our hospitals.
close unexpectedly because of staff shortages, like the one in Campbellton did earlier this summer. Nor can we continue to see service interruptions. We experienced 23 last year alone. And now that number will increase to 24. Just this morning, I learned that there's no doctor to work the emergency room at the Sackville Hospital this coming Friday night. They put out the call, but as of noon today, no doctor was able to work that shift. It could change by Friday night, but operating in crisis mode is not the right way to manage healthcare. It's unsafe and it's irresponsible. The RHAs have been patching it together for years to try to keep our system afloat. If you've not seen these issues in your local hospital, it's only a matter of time until you do. Let me be clear. These changes are not about money. I'm asking you not to buy into the political rhetoric. Every dime of the savings from the changes we've announced will be reinvested in our healthcare system and in these 6 communities. In fact, the health budget will continue to grow this year. This is about ensuring the sustainability of the healthcare system and about reallocating resources to new investments that help us to address our pressing healthcare needs. This is about improving quality of the care and sustainability. Laissez-moi être clair.
Let me be clear. These changes are not about money. Do not believe this political rhetoric. All the changes that we announced, they will be reinvested in our healthcare system and in the 6 communities. And the healthcare budget will continue to grow.
In a mental health crisis that is completely unprecedented. I have 4 grandchildren, and I am just as concerned as all of you about this crisis. That is why we've decided to invest in a new mental health clinician for each impacted community and to roll out online mental health services. The Mental Health Association of New Brunswick has applauded these efforts. Access to quality care has been a repeating theme in our province for just too long. As Minister Fleming pointed out during the announcement yesterday, there's a global shortage of healthcare workers. Provincial healthcare systems right across this country are struggling to deal with the shortage. In June 2018, the Premier of Nova Scotia announced the closure of 2 Cape Breton hospitals, which are being replaced with community health centres without emergency rooms. In fact, today alone, 8 of Nova Scotia's emergency rooms are experiencing temporary closures. That is a choice in front of us, spotty closures or well-organized, stable emergency system that you can count on. That's why we are changing hours in 6 hospitals to better utilize our resources, while at the same time investing in more nurse practitioners. These 2 changes will help reduce the provincial waiting list for family doctors by 54%. That is indeed significant. 18,000 more New Brunswickers will have access to quality care. Furthermore, the ambulance system has come much farther since emergency departments were originally put in these hospitals. Paramedics are healthcare professionals who can administer medications to treat emergency conditions and perform interventions to save a life. Our ambulance system is part of a sophisticated province-wide New Brunswick trauma program, which means when you dial 911, The ambulance is in constant communication with a trauma coordinator to make sure that you are directed to the right facility for treatment. The new hours of 8 a.m. to midnight for the 6 impacted communities are the same hours that the Oromocto and St. Joseph's Hospital in St. John have been successfully using for many years. And what's more, thousands of people across our province already drive similar distances from their communities to emergency services, like Charlotte to Campbellton, like Doketown to Miramichi, Hillsborough to Moncton, or Lamech to Tracadie. People in these communities have been safely using this model for years. We need to be realistic about our limited resources and use them more appropriately. That's why it's so sad to see the leader of the Liberal Party, Kevin Vickers, who didn't take the time for the briefing that we offered to have him learn all the details of the proposed changes, but instead comes out quickly. We'll take the government down. We'll reverse all the decisions. You know, a man without a plan only plan to reverse what the other one's done. How many times have we heard that? And what's so unfortunate is up till this point in time, when the true test is put forward, he's made great overtures about he's here for the right reasons. He's here to help New Brunswick survive. He's here to save healthcare, education. But when the first test comes, how do we take the government down? How do we reverse the decisions that are based on facts by the people who know exactly what needs to be done? It's politics at its worst, and it's exactly why our province is in the state it's in. Decisions without facts. My priority is and always will be in the best interests of this province. And in this case, it means taking tough decisions that we are facing, the HR shortages, service interruptions, and a mental health crisis, but we will tackle them head on. And it may cost us politically. And if it does, so be it. We'll sit home and know that we did the right thing, and the right thing will happen some point in time, and how many people will pay the price in the meantime in order for it to get solved. My priority
will always be to improve the system in this province. And it means we need to deal head-on with these difficult issues, the shortage of staff, service interruptions, and the mental health crisis. And if there is a political cost to this, it's too bad, but I will always do what's best for New Brunswickers. Thank you.
What is happening with Robert Gauvin and Bruce Northrup from your point of view? And what have you talked to them about in the last day?
Well, not surprising. I mean, they're under extreme pressure in their ridings, and I understand that, and in the regions. Any change, is difficult, and I'm hopeful that once it's unfortunate that the message went out of some of the plans before the details came to follow, and what would provide such access to better health care. So I guess I'm confident that as they both go through this kind of emotional situation for real reasons, that once the facts are all out there, they will be comforted by the people around them that will say, at the end of the day, we're going to have better health care. We're going to have less people that are on a waiting list for a doctor. We're going to have quicker access. We don't have to go in at midnight just to see a doctor. And in the meantime, all of our systems are in place to ensure that serious situations are dealt with quickly and promptly by the professionals in our ambulance service. So I understand what they're going through, and I think I have to be sympathetic to that, because I'm also very sympathetic to the many people that are trying to learn all the facts, and at this point in time, that's what they're going through.
There's no legislation to do this, so when Bruce Northrup talks about a decision he's going to make by tomorrow, what's he talking about?
Well, he may decide whether he can support it based on, the interest in the community. I'm hopeful that he'll support it based on all the facts and what it'll bring. But he's talking with a lot of people, as I certainly would expect that Minister Gauvin is as well, to understand what it means. But, part of change is not only weathering the storm, but it's communicating what this brings. And in New Brunswick, we're resistant to change. It's kind of the way we've always been. And as a result, we just continue to get deeper and deeper into problems and we don't deal with the root cause. So he may decide that he can't, let's say publicly, continue to support it based on the community response. But I'm hopeful when he continues to learn more. The RHAs, Karen McGrath is there today. and Gilles Lancang is in Caricat. So they're facing it head on. These are the people that know, and they're there talking to the community. So I'm hopeful in both cases the answers will be provided.
Wasn't there already a briefing for caucus where they had the chance to
Yes, indeed.
learn all this? So
Yes,
what
indeed.
more is there for them to learn about?
Interesting, there's little more that they can learn. Everything was provided in both cases, so everyone knew the details in our entire caucus. And as I said, we provided briefing opportunities to the other parties as well. The reaction by the community, who don't know all the details at this point, I get, is creating some angst. And I understand that the representatives have to be receptive of that. They're elected by the ridings. They have to recognize the emotion and the concerns as they are legitimate, they're real, but hopefully will subside when all the facts are on the table. So, I think that they have to work with their community, and that's what I certainly see him doing, and I'm I guess confident he'll continue to do that.
But Mr. Northrop, it's one thing, but Robert Gauvin is the deputy minister, is part of the cabinet, and as a member of the cabinet, he's supposed to defend the decisions of the cabinet. There is this, what we call in Canada, cabinet solidarity.
And
What
that
is the solidarity right now?
Well, and that's true. That is the system we operate under, and so in this situation, while the comments that are being made, I think are born from the reactions in the community. I'm confident that as he goes through this as well, he will feel that okay, I understand why this is going to be a benefit at the end of the day. The emotion is strong, and the reactions are strong. So I know what you're saying. And I could take a typical position, maybe that past premiers would have. But in this situation, and especially in the situation that I'm in government, you basically look at it and say, I've had a lot of diversity in my group. I've had a lot of and you could think of them as much as I can right now. I made the comment in the past about, I was one that was a little bit outspoken when I was in finance. So I'm sympathetic with it, and I'm not going to overreact to it, because my goal is to fix the issues that are chronic in our province, the issues that have not been addressed, and work with professionals to do that. My next challenge is dealing with mental health in a real way, the addiction that we see in crystal meth in a real way, and I'm going to just continue moving forward to do what's right, and we'll work to hold our group together to make that happen.
But if he sticks to his point, does he still have a place in the cabinet?
Well, he'll have to make a decision, obviously, in the coming days. And I guess I'll leave that for him to continue to discuss at this point. But obviously, this wouldn't be the norm. This wouldn't be the situation that I would be hopeful of or expect. But I can appreciate the pressure he's under.
So you would ask him to leave then?
No, I at this point, I haven't made any decision.
Not now, but if he stays with this point of view.
Well, I think that he cannot like this process. I think he cannot like this what he thinks this is doing. I am convinced that in 2 months' time, 3 months' time, 4 months' time, the people in the communities who now can go into an emergency room and be seen, can now go in and see a nurse practitioner or a mental clinician. I am convinced that they'll say, wow, what were we complaining about? So he too is going through that period.
Bruce Northrop said that he spoke to you and Ted Fleming after the announcement yesterday. Can you talk about that conversation and whether you think there's any risk he might quit the party over this?
Well, I would like to say that there isn't a risk, but I suppose there's always a risk. But I don't get that in our discussion. He did identify the anxiety in the community and the I guess the kind of the rallies that were being held, but that was why the CEO went there last night. She planned to go anyway and be there, but she went a little earlier to be there last night as well as today. I touched bases with Bruce and basically just asked him how it was going, and he's going to be connecting back later. He said, we're listening, getting all the responses from the community and the facts, which I'd expect him to do. So I'll be chatting with him later tonight, and we've been in touch with Minister Gauvin as well.
Point of divergence seems to be Minister Fleming said, enough with the consultations. We got these reports that are getting getting dust on the shelves. Yet Mr. Northrop says that one of the biggest problems he sees with this, or he's hearing, is the lack of consultation with the health community in Sussex. How do we reconcile that?
It is a challenge because, in any community, if you go into the community and say, here's what we're going to make for changes, getting that endorsement or that support to do that, change is never easy. And every community looks at it as to what I'm losing rather than what I'm gaining. And in this case, the medical society, there were discussions of the medical society with the nurses union, with the nurse association. There certainly was discussion with obviously the CEOs and the board, the health authority, the health boards, council. So the idea is that how far do you go? I mean, even in that limited, I say limited, but in the discussion with those bodies, it leaked out. And now, I would have preferred that didn't happen because I would like to have the chance for the health authorities and the minister to put all the facts on the table before that. So we're playing a little catch-up in that regard. But if you start talking, to kind of everywhere, then it takes on a life of its own before you ever get to the point of, okay, what are we going to do differently? Because the one thing that we do know is that the status quo is not acceptable. We have challenges that if it doesn't get addressed here, it will hit us even harder later. We've seen hospital closures. We've seen service closures. We have a path to keep our hospitals open and to have them deliver better primary care and service to these communities and to be there when people need them. And it's coming whether we like it or not. These hospitals, are a vital part of our communities and provide a vital service for certainly, what we're talking about here with our aging population. It has to happen. We have to fix this. So it was interesting, the comment from the CEO of Vitalite, Gilles Tang, who said yesterday that this was the first time in his 20 years that he'd ever been allowed to make the decisions necessary to deal with the chronic issues that are in front of us without it being a cost item, without it being a budget cut. This has nothing to do with budget. There are no savings here. We're putting money right back into getting better results with our resources.
The nurses union yesterday initially said that they are supportive of these changes, but today they told me that after talking more with the RHAs, they have some serious concerns about how this is being rolled out. They said that this appears to be rushed and that there hasn't been enough thought given to the actual support systems, particularly looking at the ER closures. What's your response to that? Do you feel that this is a little bit rushed, that in a month we're going to see 6 ERs no longer open overnight?
I guess the best persons to ask, is it rushed, would be the CEOs who have been trying to make changes for years, and the people in the positions that know the challenges we face. No, I don't think this is rushed, but I do think that the nurses union have a valid comment to say we want to be part of how this is implemented and what it means to us every day. And that's absolutely the right thing to do, and we would want to do that as well. I would want that done. So I think that becomes more of the issue is, okay, we have a system, a different system. Now, what is the best way to ensure that we meet the targets we want with better access to health care and that we meet the challenges in a community in terms of emergency services? And so to work with them and keep moving forward in that regard, they need to be part of it, absolutely. But, if you never make a move, you spend all time talking. And how many times have we said, so often government doesn't act. They just talk and they go in circles. We have a crisis in healthcare, and I can't say that enough. And I'm not prepared, even in the precarious situation that we're in. And I see my colleagues here today that are taking a stand with us, saying, we need to fix this. We're here to fix it. If we're here at the end of the day, we'll have fixed it and we've moved in the right direction. If we're not, we'll say we tried, we did it, doing the right thing, and people weren't ready. But our system is ready and needs it. We'll move on. We'll just keep moving in the right direction and what is required and working with the people to get it done.
When I talked to paramedics today, one of the things that kept coming up was the lack, really, of advanced care paramedics. One of the things that they said that they feel that they could really fill the gap in a lot of these communities of emergency care by allowing paramedics to practice at their advanced care level. Is that something that could be part of this change, or that was looked at in your knowledge?
Well, certainly looking at the nurse practitioners and making the move, about 32 additional nurse practitioners, and I think we already have like 14 or so in the system that can, so we can deploy them to these particular hospitals, and so we can start that immediately. And working with the paramedics, and we recognize the significance role in promoting the reclassification was because it is a critical component. These are our emergency rooms on wheels, and they do bring that value. To look and say how many people are in the system that have advanced care credentials, and would it make sense to deploy them to these areas? I think that would be a very valid discussion to have. And is it required? Maybe, but I'm not sure it is. We have had discussion with Medavie about ambulance service in these locations and ensuring that they are available. But I think it's a valid discussion to have with the paramedics and with Medavie.
There's going to have to be a lot more movement of patients by paramedics as well. Number one, to get these ALC patients from larger regional centers to these smaller hospitals where we'll be setting up these long-term care beds, and also for emergency services. Is there any, how are you going to ensure that we have enough paramedics and that we're recruiting well enough to ensure that there's enough people on the job to counter this increased burden on the system?
Well, so right now, I think it's important to know that in just changing the hours of emergency service in these 6 hospitals doesn't really add any real significant change to the ambulance, because in looking and analyzing the average of people that would be there at night, some people were coming because they could actually get access. So we're saying we're going to have that access in the daytime. And to the emergency conditions that were really serious, they were going right to another hospital anyway. They weren't staying. So that by itself is nothing's really changed for the ambulance requirements. But to your point of moving people to these locations, yes, we have a different transfer system that was set up with Medavie, and that will require, but that will be ramped up as people are moved and as the system develops to do that. So that's not like something that changes tomorrow when the date is for, but it's something that would require additional, let's say, resources when these transfers are made and as we set up. But that's not something that's immediate with hospital emergency room changes.
In your presentation, you said that it could cost you politically. Do you think you could lose power over this?
It's possible. Yeah. And it's sad. It's sad only in the fact that no matter what people are saying, the political rhetoric will abound. But I've said, and I hope this is certainly a clear and a clear reaction or situation that I've said for many times. I am not here for the goodness of my health. We have to fix our situation in this province. And we have to make decisions that are not popular. I've said it many times, but people can understand the facts and the reason. And this is one of them. I've talked a lot in the last few months about changes coming. You know, we have a bubble in our demographics that you see that we can't ignore. And we have a decline. In Ontario, the Premier tells me 250,000 workers they need in Ontario. We need 10, and we know what's happening at 120 over the next 10 years. And in nursing alone, and healthcare workers. And we're competing with other provinces. So we must do this. And if it costs us government, I'll rest easy saying, you know, we did what was right. If we lose government and we don't do what is right, then you sit home and you say, I wish I'd tried. Well, I'm not going to sit home and wish I'd tried. If I sit home, it'll be because we wanted to do the right thing and we were prepared to do it and put our jobs on the line. And because we know at some point it's going to happen.
You talked about, you know, Mr. Gauvin would have to eventually kind of come around if he wanted to stay in cabinet. What about Mr. Northrop? You know, if he decides that he wants to stay with the party but can't support this and publicly speaks against it, will he still have a place in the party?
Well, it won't be the first time we've experienced that sort of situation. And I'm not just talking about Mr. Northrop, but in the case where, you know, colleagues would feel like, okay, I don't really feel good about that. You know, it's not a good position for me to be in as the leader. I appreciate that. It's difficult. People would expect probably I'd spend more time at maybe in that situation to deal with that than actually trying to move the bar. I feel that at the end of the day that my colleagues will feel the same way when they look at the necessity to make changes. And at the time, it's tough. It's tough when your community is there and saying, you know, we don't want change. But we have to be sympathetic we have to be sympathetic with the real concerns that people are bringing forward, and we have to be. I feel I have to be sympathetic with the real concerns that my colleagues are facing in their writings, and that's why it's a combined process. And for me to react in a aggressive way to my colleagues who are experiencing real emotion in their community, I think would not be conducive of a leader who cares. And I do care. And we need to work together to fix it. All right? Thank you.
Thanks very much.